CNS lymphoma is typically an ABC subtype of large cell lymphoma, which is B-cell receptor-driven. And frequently it harbors MYD88 mutation, which actually provides some approaches of targeted therapy in this space. We know that BTK inhibitors are somewhat effective, but the response rate is moderate, and more importantly, the duration of responses are limited. Therefore, novel agents added on the top of BTK inhibitors could be very useful here. And such an agent is emavusertib, is an IRAK4 inhibitor, which really inhibits the myddosome pathway in addition to BTK pathway. And the rationale behind this combination is to actually use both inhibition of BTK pathway along with IRAK4 inhibition at the same time to provide this dual inhibition downstream, because that's a major mechanism of resistance to BTK inhibitors. In other words, adding emavusertib can overcome resistance to BTK inhibitors. So this has led to a clinical study called TakeAim, where patients who progress on BTK inhibitors with primary CNS lymphoma can be then treated with emavusertib and BTK inhibitor. And so this dual inhibition here is quite important in this concept. So the study provides an important proof of principle that this preclinical synergy and overcoming BTK resistance may indeed work. And in 14 evaluable patients which were exposed previously to BTK inhibitors and refractory to BTK inhibitors with primary CNS lymphoma, 3 patients had complete response, and additional 2 patients had PRs. So that's very promising, and some of these responses are still ongoing. Obviously, we need to see more patients on this study to better capture the response rate. But nevertheless, very early on, there is a great example here that this preclinical concept can indeed sensitize the tumor cells to BTK inhibitors.